I'm Lindsay. I'm an emergency medicine clinical pharmacist, and these are some pharmacy interventions that I've made over the last few months. I added Flagyl to an open fracture antibiotic regimen because this patient had been cutting down trees with a chainsaw and then cut their leg and broke their bone with the dirty chainsaw, and Clostridium perfringens lives in dirt. We got to cover them. Methanol poisoning patient, but there were also a lot of other drugs and substances that could have been involved, and so we had them on leucovorin and fomipizole and onto CRRT, and so I had to adjust the dosing and intervals to CRRT dosing. I was the only clinical pharmacist, so I run between ER and ICU a lot on those days. And I was in ICU. Patient whose QTC was 578, and the cardiologist ordered Sotalol on them. Sotalol can really prolong your QT, and so I let the cardiologist know, and he was like, oh my gosh, thank you, I don't want to start that, and we switched to something else. I had a patient in respiratory distress who was tolerating BiPAP but was just getting really agitated, causing them to try to pull it off, so I guess they weren't really tolerating it. The patient that I was working with was like, well, maybe I should just intubate them. Precedex, baby. Precedex. Saved the patient from being intubated, and also taught this resident how to use Precedex appropriately. I walked into my shift with them intubating someone with ketamine, which I love, love. So proud that they were using ketamine. However, they didn't have enough ketamine in the Omnicell, and so they were like, I guess we won't be able to use this. Wrong. Ran my little booty over to the pediatric ER, emptied their Omnicell, got enough. We have more than enough now. Also, I fixed my discrepancies. No discrepancies. Everything was ordered and administered appropriately. It's all there. My hospital still cannot get Bicillin. I know a lot of other hospitals in the area can. We cannot. I don't know why we are being punished, but we cannot get Bicillin. So syphilis, you get some Doxy. I taught one of our new mid-levels that. So I love Doxy. A provider ordered a lactulose enema on a poor grandma who was on hospice, and I was like, please don't do this to her. She was eating, she was swallowing, and so we switched it to oral, and I saved that lady from one of the worst experiences of her life. But we had a patient who was having a stroke and needed some aspirin and they couldn't swallow, so rectal it works. There are a lot of things you can put up there and a lot of things you can't and a lot of things you shouldn't, but a suppository, sure, if it's appropriate for you. Don't just go putting things up there. Ask a healthcare provider. Patient with a 103-degree fever couldn't get IV access and they couldn't keep anything down, and the provider was like, well, we'll just wait for the PIC team to come. You ever heard of a Tylenol suppository? Because I have. And I gave it to him. I mean, I didn't give it to the patient. I ordered it. Sorry to the nurse who had that patient. But they got treatment appropriately. Those are a couple of my interventions. Comment down below any interventions you've had as a pharmacist or any sort of healthcare provider. We all make interventions every day to improve patient care, but that's what I have done. None of my providers are making mistakes. This is just my job. This is my disclaimer, by the way. As a pharmacist, to intervene on patient orders and make sure we are getting the most appropriate medication to every patient per guidelines, data, and individual factors. So I love my patients, I love my job, but that's what I've done.